So I've met some of you, not met at all of you, but I'm Sarah Holmes. I'm the physio with the adult service in London, so the rare mitochondrial disorder service in London. I'm going to talk to you this afternoon, this evening, about pacing activity and exercise. So as this is an online group meeting, I obviously won't be able to put my hands on and assess you or to get to know you individually. So it won't be possible to provide individual specific advice or treatment recommendations. But the aim is that I give you a bit of an overview, maybe some things to consider, some options and some considerations that you may want to explore or focus on. So I'll crack on. We've got, I think the next 20 to 30 minutes will be me talking, and then some people have sent questions. And as Katie said, we'll have opportunity to ask questions in the meeting as well. So I'm going to focus on mitochondrial disease, just giving a bit of an overview of the huge range of different ways that people's movement and balance and fatigue can be affected. I wanted to touch on well-being and fatigue and share some tips from people who live with mitochondrial disease about things that have helped them. Some resources within that, and then thought we'd think about activity and exercise, and I might get you moving. Something to look forward to. There is a huge variability with mitochondrial disease, but also in terms of local services and facilities. So with this in mind, I can't give any specific advice or signpost because there'll be different resources, different options available for you all locally. But the GP or some new posts, a social prescriber or a wellness coach attached to the GP might be able to advise you as to what's available for you or the local teams. And just to say as well that whilst mitochondrial disease is rare, local physios all physios are trained to assess and treat what they see. So whilst a physio might not have worked with loads of people or many people with mitochondrial disease, if you're referred, say, for balance, they'll assess your balance and recommend treatments associated with that. And the local teams can also reach out to us if there's anything helpful to talk about your condition or think about advice. I hope that's a helpful introduction. And I thought it would be helpful just to share for those of you that aren't aware of it, our website. So this is the Three Centre website. So this is for the rare mitochondrial disorder services in Oxford, Newcastle and London. And it's a good resource, actually. The Lilly help to maintain it, which is great, but it's got information about diagnoses, care guidelines and guidance, contact details, information for professionals, and we're all very happy to be contacted if individuals or local teams have questions about care. So thinking about that variation that I mentioned, so these are some of the huge range of ways that people may be affected by mitochondrial disease with regards to their movement, their balance, and their function. Important to remember that everyone is affected in a very different way, and that might change over time. So even within a family where there's the same genetic change, an individual might have very different challenges and barriers in any moment. So walking and difficulty getting around can be a part of an individual's experience, as can balance. Pain and fatigue and exercise intolerance are symptoms experienced by some, but as with all of these things, not all people with mitochondrial disease. And more rarely, there can be weakness of respiratory muscles, breathing muscles, or problems controlling movement with movement disorders. And just to highlight that because there's such difference and such variation, it's really essential that each individual, each person has an assessment if there are questions and queries. That assessment, that in-person assessment, if possible, helps to identify each person's unique challenges and strengths at that time to help plan the most important, appropriate and meaningful treatment for them. If you're referred to a local team, the therapists might focus on goals at that time. So that's supporting you to work towards a specific point or address a specific concern or achieve a specific outcome, and that might be time limited. But this will be guided by your individual circumstances and priorities. So just to highlight that assessment's really essential. Now, thinking about well-being. So well-being's really variable and complex, actually. Fatigue, sleep, mood and stress, activity and exercise might play into and affect an individual's well-being differently at different times. But again, that as there is that variation, and as each individual will experience unique challenges, it's really important to have a tailored individual approach to help them to best manage symptoms and optimize well-being. So I'll go through some tips and strategies and share some resources that will give you a bit more information. But well, I'll just touch on some suggestions now. I want to introduce you to fatigue because I think one of the main things that I'm told by people living with mitochondrial disease is that it's really not understood. So I'll give you some comments, and maybe some of these will ring true with some of you. The professional or detailed explanation within the literature and within papers and research looking at fatigue is a subjective lack of physical and or mental energy that's perceived by an individual or caregiver to interfere with usual and desired activity. That's a bit of a mouthful, but elements of that may ring true or may strike a chord with you. But really it's different from tiredness. It's often confused with tiredness, but if somebody's tired, they might be able to go to work and do a full day's job, whereas that wouldn't be the case with fatigue. Fatigue can be mental, can affect thinking and concentration and memory, and can be physical as well. It's different from person to person and within minute to minute often. And there's not always a rhyme or reason to why someone may feel more fatigued. It's not always helped by rest. It varies day to day and fluctuates, as I've said, and it's invisible. It's hard to understand, hard to describe, and hard for others to understand. So these all create challenges. These are some statements. So myself and some occupational therapists and neuromuscular care advisors from across the country developed some fatigue management guidelines. And these are statements for people with neuromuscular conditions, but a few people with mitochondrial disease contributed. And I thought I might share these just to see if these ring true for any of you. So someone said having fatigue was like living under a weighted blanket. Someone else said it felt like they were driving with the handbrake on and no petrol in the tank. Felt like carrying bags of sand around their legs. Someone else felt very weak, extreme lack of physical energy. And somebody else said that they felt sluggish and their body felt very tired even after very little activity. So the things that can contribute to fatigue and influence an individual's experience of fatigue are also really varied. These are some examples of factors that some of which may be modifiable, and many of which will be considered within a mitochondrial clinic appointment, so that multidisciplinary approach where possible. Just to give you an example of the environment when we're thinking about modifiable factors, somebody with really severe muscle weakness that struggles to sit upright and who experiences more fatigue, more difficulty as the days go on, might benefit from some time in a reclining or a tilting chair. But someone else with a different set of challenges and a different situation might find that organising their desk or their workspace in the kitchen might help to conserve energy. So having things nearby to reach. So they're just some examples. But questions that are sometimes helpful to consider for an individual are whether your sleep's disturbed, Do any medications you take contribute to your fatigue? And could you discuss those with the doctor? Whether that individual is taking exercise. How much is mood playing into someone's experience of fatigue? And how does the fatigue vary and fluctuate throughout the day? Also, it's important to consider whether rest helps. So I've given some examples here about different ways that it might be possible to start to understand your experience, your individual experience of fatigue. And once we can understand that, we're in a better position to think about different techniques and strategies and tips that might help to conserve energy or manage fatigue. So I've got some graphs here, some of which may be familiar to you, but I'll just talk these through. So the top graph, on the left-hand side here, this is activity. This describes activity level. So at the top here, where it says high, this is to describe a lot of activity, and low is no or very little activity. And then along the bottom with these numbers, these are days or weeks. So where someone's feeling really good, they might do loads, go out and do loads, clean the whole kitchen, go out for lunch, do all the hoovering, do gardening for an hour, whatever it is. This is what we describe as a boom in activity. So you're feeling good, you boom. And often that boom is followed by a bust. So where you run out of energy and you might need days or sometimes weeks to recover. So that's called the boom bust cycle of activity and inactivity. And sometimes in day-to-day life, you might need to plan that. So for a hospital appointment or going out, something above and beyond, you might need to allow time to rest. But if this is a cycle that's happening regularly, you can lose the benefits of the exercise. So resting in bed or resting, not moving from the chair for a day or two, can mean that the muscle strength that you gain from that boom in activity can be lost. And that can make it even harder when you come to move again. So this bottom graph shows the kind of optimum in terms of managing energy and activity. And little variations are more helpful, little bits, and avoiding those big boom and bust. So there's a bit more consistency over time. So that can be one of the aims and one of the things that therapists and occupational therapists in particular might help you to look at. Top tips from people with mitochondrial disease who have fatigue are that it's important to listen to stop and to listen to and to trust your body. So if you feel that you're starting to push, that can often be a sign that it's a good time to stop and rest. And then I've got some top tips here. So just some headlines really, but if any of these sound like they might be interesting to you or you think you might like to have a go, you can find more details in the managing fatigue resource I'll share the information for. So I love a catchphrase. Time not task is one of my top catchphrases. So rather than cleaning all of the kitchen or doing an hour's gardening, doing all of the garden or doing all of the lawn, some people find it helpful to set an alarm actually and do 5-10 minutes of activity, stop and have a rest, reevaluate, and then go back to it. And actually, if you think of your energy levels like coins, you want to budget and save your energy, your energy coins for the whole day. So using this strategy, time not task, doing 5 minutes and then resting and going back to that activity can give you a better chance of checking in, of budgeting and of saving energy for later in the day. Pacing activity and planning rests are other strategies that some people find helpful. And it's often good to rest before you start to run out of energy so that you can conserve those energy coins for later in the day. Prioritizing, postponing and delegating tasks and activity can also be helpful for some. Looking at the environment, as I've mentioned, and sleeping and eating well are also really important. So if somebody has problems getting off to sleep, Winding down and having like a relaxation routine an hour or two before bed can be helpful. Avoiding devices or screen time or stimulation or exercise before bed can help others. Having a set time where you go to bed and get up can help with that sleep cycle, that automatic sleep cycle. And also, if you have trouble getting off to sleep, getting up and maybe changing rooms if you can, if you find that you're unable to sleep for more than 10 to 15 minutes. So one of the examples I've given here, and I'd say the top tips really for fatigue are trust yourself, time not task, and then rest breaks. So I thought it might be good to show you a resource that some people find helpful. And if you're happy, we can all have a little go at some relaxing breathing. So this is just 30 seconds, but if you follow along with the video. So hopefully that's a bit of an introduction. It doesn't work for everyone, but it's 30 seconds. And sometimes it can just doing something like that, finding the right thing for you, of course, can just help to give you a break. Oh, sorry, didn't mean to play it again. Can help to give you a break and help you to take stock and manage and conserve your energy. So this is the document and the resource I was mentioning. It's really detailed, it's long, but the idea is that it focuses on each of those areas that we've talked about. So mood, sleep, exercise and activity, and give some top tips that people can try. So I've got the link for this resource at the end. It's developed not for people with mitochondrial disease, but as I said, quite a few people, some here, contributed to this document. So it's got some good tips and something that occupational therapists might use with you as well. So then to come on to activity and exercise, I thought I'd just go through a few considerations with you. So with any new activity or exercise, the aim is that you shouldn't feel muscle pain or pain for more than 48 hours after the exercise. So for everyone, if you're doing something above and beyond what you're normally doing, so it's really challenging the muscle, you get something called DOMS, delayed onset muscle soreness. So that would last for between 24 and 48 hours, but after that, the muscle will return to normal. Lots of people with mitochondrial disease experience pain for longer than that and much more intense pain. As one of the statements, the fatigue statement said, it might be that a small amount of activity or exercise triggers that muscle pain. But the aim is for any exercise and activity that you should feel comfortable, shouldn't have pain for more than 48 hours. It's good not to exercise to the point of exhaustion, so just to do a bit and think about what you can do comfortably. And exercise activity doesn't need to be going to the gym or wearing lycra or anything. It's any movement at all. Even sitting and having a stretch or a little dance in your chair can be a good way of starting things off. A patient actually during COVID, during lockdown, suggested this idea of snackercise, and it's not to suggest you should be eating more, but more to think of movement and exercise as you would think of food and snacking throughout the day. So what your body needs. So that might be a concept some of you find interesting. Fatigue, if you are fatigued and you do experience fatigue, it's good to make sure that you've got enough energy to get washed, to dress, to get to bed. So you're conserving a little bit for those essential tasks that you need to do. If you have problems with your balance or movement, it's good to make sure that you're in a safe space. You're not exercising somewhere where you could trip. And it's important where you can to enjoy what you're doing and for it to be meaningful. Enjoyment might be a push if we're thinking about exercise, but But could you tap a bit of extra movement onto something that you do already into your normal daily routine, your day-to-day life, waiting for the kettle to boil, brushing your teeth, or watching the news? It's good to avoid sitting still for too long and to get a bit of movement in, however that looks for you. And do talk to the team or contact one of the mitochondrial disorders physios if you have any questions about exercise. It's just frozen, but hopefully it will move on in a sec. Yeah. So some more considerations. So I talked about doing what you can comfortably, not pushing to the point of exhaustion. And a good rule of thumb is whatever you're doing, whatever exercise you're doing, it's good that you can comfortably talk in a full sentence or sing. Singing isn't compulsory. Some tips that people have shared with me over the years are adding a bit of movement into something you're doing already, as I've mentioned, maybe cleaning your teeth, waiting for the kettle. Finding something that you enjoy can also be helpful. And telling someone about your plans can be a good way to start a new activity. And this is challenging this. This is about behavior change. So lots of people appreciate that things like going on a diet or giving up smoking, people know that they're hard things, but actually starting exercise and activity is a similar behavior change. It's similarly challenging. So I think one thing at a time, go gently and try and build up gradually as you can. There's a chart here called the Rate of Perceived Exertion Scale, RPE, or the Borg scale. The name doesn't matter particularly, but it's a 10-point scale. It's one version of this where 0 is nothing at all, complete rest, and 10 is working very, very hard, so to the point of exhaustion. The mitochondrial team and cardiologists would always recommend that you work at a moderate to somewhat hard level, a 3 to 5 on this 10-point scale. And you know you're at that point if you start to feel a little bit warmer, perspire, or have a dew if you're a lady. Take deeper breaths. But as I say, comfortably talk in a full sentence or sing. That's the crux. So I promised you a bit of movement. I won't make you sing, but I wondered if we could have a little go at some exercise. So if you just follow along with the video.
All right. Have to have a new attitude whenever you're tackling a different obstacle in life, new job, new annoying neighbor, new teacher at your child's school acting up, all that stuff. Always have a new attitude, a good attitude. Okay, not a bad one. Try that out. Yeah. Press it up for two. You go up, down, forward.
Oh, Lizzie's getting right into it. Brilliant. I just thought I'd give you a little taste. That was just 40 seconds. I felt that I was getting a bit warmer and taking deeper breaths. I don't know if anyone else did, but that's just to show you a little example of building some movement into your day. And over time, if you can do that more regularly, not necessarily with this exercise, but find something that you enjoy, that can be really helpful for your exercise capacity and sometimes fatigue. So tips for exercising, some more tips, full of tips today. Keep hydrated and carry water with you when you're exercising. If you're diabetic, check your blood sugars before and after exercise and make sure you're well nourished, you've had some good nutrition. Always start off low, and for a short amount of time, do what's comfortable and build up slowly and try and make it part of your routine. Sometimes adding that movement on something you do already, or habit stacking, as I heard as a term recently, can be a really nice way of getting that happening consistently. And if you are exercising, maybe plan a rest day between exercise days. And a couple of safety considerations. So never exercise if you're ill, if you're suffering from an infection, or if you have a temperature, or if you have severe fatigue. So severe fatigue meaning a very different experience for you. When you're exercising, you should feel slightly out of breath, but be able to hold a conversation, comfortably talk in a full sentence or sing. Your heart rate might be a bit higher. You might feel slightly warm. Many of you will have routine cardiology or heart follow-ups and heart checks. If you have any specific questions about exercise or how hard you can work, or have any questions, you could ask the cardiology team, they'd be happy. But we work quite closely with a cardiologist, and he always says, yeah, low to moderate intensity exercise is helpful. And he also recommends that working till you can comfortably talk in a full sentence. That's a good gauge. So if you did experience any severe or intense symptoms of shortness of breath, lightheadedness, dizziness, clamminess, or palpitations when exercising, if they were quite severe and you hadn't experienced them before, you could discuss with your GP or call 111. Or if these are things that are happening gradually and you're concerned about, you can talk to your clinical team or cardiologist. So I've got some resources here. The first two are on that innate mitochondrial website I mentioned. So there's a at a glance physiotherapy guidelines, and there's some physio guidance that we're updating at the moment, and then that fatigue resource.